Hi, my name is Jocelyn. I'm from Lystra Physical Therapy and Wellness, and most likely you are here because you're one of our patients, and I've directed you here for your perineal massage instructions. You should have gotten an instruction handout as well, but this is a great visual for you and your spouse to be using when y'all are doing your perineal massages. Now, as we've talked about, this starts about 35 weeks of gestation, and you want to be considerate of any kind of precautions your midwife or your OBGYN have given you. If they've told you to go on pelvic rest, then you don't need to be doing this. If you wind up losing your mucus plug or you have a bloody show or anything, then you need to discontinue this perineal massage. And of course, let your OB or your midwife know that these things are happening, because that's exciting. That means labor is on its way. So I'm going to go through this with you. The point of this is to help reduce your chances of tearing. We don't guarantee that this will stop your tearing, but because you're teaching those muscles to relax and stretch out before baby comes, it's just like you'd be stretching your hamstrings before you start going and doing sports. You know, we're really preparing that muscle to do a job. So that's what we're going to be practicing. It's best for you and or your partner to do this when you're relaxed, maybe after a bath, or even placing a warm compress at the area for about 5 minutes or so. And it's probably gonna be easier for you to have your spouse do it, and or we'll do it for you in clinic, but it needs to be done anywhere between 1 time a week, which I prefer you to do it 3 to 5 times a week. So, and it's gonna be about a 5 to 10 minute process depending on how slow you go with it. So, because of the way that you have to do this, spouse is going to probably have an easier time doing it because you're going to have to reach around baby. So after you get out of the bath or you do your warm compress, you're going to sit yourself up on your bed, propped up with your knees bent. You can even put a mirror at the end of this, maybe propped up on a pillow so that you can see what you're doing if you're doing it for yourself. And you're going to take 2 thumbs, or if it's your partner, they can use two index fingers, and you want to use either a water-based lubrication such as the slippery stuff that we use in clinic, or you can use any olive oil or coconut oil, and midwives even may suggest that you use primrose oil. So what we're going to do is we're going to start out with our thumbs or spouse's fingers at the bottom of the vagina, right at that opening, and we're going to be putting pressure directly down towards the rectum and out. So what I usually teach is to start by pressing straight down towards the rectum, holding that for 1 minute, and then you're going to go more in a diagonal direction out to both directions, holding that for 1 minute. And then I like for you to go through and sweep from, now you can do this with 2 fingers, or sometimes I like to show it with 1 finger where you're just doing a U shape all the way up the sides of the opening and just stretching that for about 3 to 5 minutes. You can use just maintained pressure if you feel like one spot's a little bit tighter than the other. Now, what I want you to think about when we're doing this, the feeling should be like stretching tissue. It should not be painful. If it's painful, then I want you to discontinue doing it, or back off and see if that gets just that stretching feeling. Now, in order to feel the correct feeling of this, what I want for you to do is take your 2 fingers, stick them in the corners of your mouth, and pull until you feel that kind of burning, stretching feeling, and that's what you should be feeling down there. So you'll just take your fingers into your mouth and pull and stretch until you feel stretching and burning around the lips, so that can mimic the feeling that you should be having in that area. So if you have any questions or concerns about this, give us a call. Always make sure you're feeding back with your partner and letting them know, yep, that's enough pressure, that feels good, or you're good, keep putting a little bit more pressure there. So if you have any questions, let us know, and we'll see you at your next appointment. Congratulations, Mama.